Hello, everybody. Gonna let people filter in before we get started.
Caitlin, so there is an attendee labeled interpreter, and that is who you will promote to a panelist.
All right, I think I did. Is he on there?
Okay, I do see him on the panelist list now, so.
Yep. All right, Katie, are we good to start?
We're good to go, Caitlin. Thank you.
Awesome. All right, everybody, welcome, welcome. We're so glad to have you today. This is the Central Carolina Area Agency on Aging June webinar. We're going to be talking about hearing loss and communication equity. If you've been with us before, this is a repeat, but these are just a few of our Zoom webinar features. So you are automatically muted. You cannot see other participants. You will see speakers and hosts. Please ask questions via the chat box, and the session is being recorded and will be available after today for you to view on our website, and we will send out a reminder with all that information as well. So join me in welcoming our speakers today. So we have Katie Franklin with who is the Hard of Hearing Services Coordinator, and Marilyn Edwards, Hard of Hearing Services Specialist from the North Carolina Division of Services for the Deaf and Hard of Hearing, which is under the umbrella of the North Carolina Department of Health and Human Services. Without further ado, I'm going to turn it over to Katie and Marilyn.
Thanks, Caitlin. I appreciate the introduction. So I am Katie Franklin, and I'm the Hard of Hearing Service Coordinator, and I will let Marilyn introduce herself.
Yes, hello. Good morning, everyone. I am Marilyn Edwards, Hard of Hearing Services Specialist in the Asheville Regional Center. Welcome.
Thanks, Marilyn. And before we get started today, I want to introduce everyone to two accommodations that we have here. First, we have American Sign Language interpreters that you will see on screen, and they're providing communication access for our ASL users here today. We also have communication access real-time translation, or CART captioning for short. And this captioning provides access to communication for individuals with hearing loss by providing a live word-for-word transcription of the presentation today. Even if you don't have hearing loss, I encourage you all to turn on CART today by clicking on the CC button on the bottom of your screen and selecting Show Subtitles. Or you can view them in a separate browser or separate device by using the link that's in the chat box. And Caitlin, if you can go ahead and cut and paste that CART link from earlier into the chat box so everyone has access to that. So I encourage everyone to try this today, and it will just give you an idea of how CART can provide access to people with hearing loss in remote settings. So I'll give you all just a second to pull up the captions if you haven't done that already. All right, and I'll go ahead to the first slide. All right, thank you. And Caitlin, I just want to ask if you can make sure that when the interpreters pop up, if you pin them on the screen as well, that way the recording will also have the interpreters and the speaker pinned on screen. Thank you. All right, so I want to begin by sharing some demographic information about North Carolina residents. You'll see our state's population here, as well as historically marginalized groups, with the deaf, hard of hearing, and deafblind population being around 1.2 million. Now, the difference between these demographics is that the information for the deaf, hard of hearing, and deafblind population are only for those who are 18 and older, while the others reflect from birth onward. So as you can see, these statistics are actually an underestimation of this population. There's an expected 33% growth rate in hard of hearing individuals, with only an expected growth rate of 21% for the general population. And here we have some percentages by age range to give you an idea of the folks in our state. For those that are 18 to 64, about 16.2% of the population has hearing loss. 65 to 74 is about 30%. And 75 plus is about 50% have hearing loss. So as you can see, when we're discussing the aging population, a large portion of the people that you may be working with have hearing loss. Next slide, please. And I'm going to pause for a second just to ensure, can someone, one of the attendees, send a message in chat and just make sure that you can see the sign language interpreter? I did see a message from earlier that someone said that they couldn't see the interpreter, so I just want to make sure that they are visible for all the attendees.
The interpreter is pinned right now.
Okay. And I see folks saying that they cannot see them, so I'm not sure. Maybe they have to pin them on their screen. Okay, and Spotlight, I see that Spotlight is for also.
I just spotlighted them as well.
Okay.
Okay,
Perfect.
there we go.
All right.
Thank you for your help, everyone.
Thank you. All right, everyone's saying they can see him now. Perfect. Great. All right. So hearing loss is a hidden disability, and it's often overlooked or misunderstood. And the goal of our agency is communication equity, which is a simple goal, but it's not always easily achieved. So I'm going to talk about the different populations that our agency serves. For the deaf, those are mostly born deaf or become deaf prior to spoken language development, and they primarily use ASL to communicate. Hard of hearing, for this population, we're referring to those that lose their hearing later in life and they don't know or use ASL to communicate. Some are also born hard of hearing or gradually lose their hearing over time. In this population, communication preferences can be vastly different depending on the onset of loss, significance of loss, when they utilize technology or other accommodations to communicate, and some may not even be aware of their loss or their communication needs. For the deafblind, these individuals can have varying degrees of hearing and vision loss. Communication methods will vary significantly depending on the onset, level, and type of hearing and vision loss. It's important to remember that there's no one-size-fits-all approach to achieving communication equity among these groups. Next slide, please. So on this slide, when I'm talking about hearing loss, I'm referring to those adults who lose their hearing later in life. There's typically a 7-year delay between the onset of hearing loss until they seek help or treatment. This can heavily impact a person's ability to benefit from a variety of services when they don't have proper communication. For example, a person attending informational sessions at a senior center may not reap the benefits of the programs they go to learn about because they don't hear the information and they're not aware of what's available to them. There are many reasons for this delay in seeking treatment, but a few of them are being unaware of the link between adult onset hearing loss and their overall health, hearing loss denial, the high cost of hearing aids, and lack of access to information. There's even longer delay among veterans because of their military culture. They don't want to be viewed as weak, or they don't want to take services away from others who may need it more than them. This may have a slow boil effect. As a person waits longer and longer to seek treatment, things become more difficult, and it can start affecting many aspects of their life. This can lead to poor social skills, poor self-advocacy skills. And here at our agency, we often see that it's the adult children of our consumers that reach out to us for help, and not the consumer themselves. As you see in the yellow box there, we're showing you that over 90% of people with adult onset hearing loss can benefit from hearing aids, but only 16% actually use them. Imagine the significant impact this has on communication. Next slide, and I will now turn it over to Marilyn.
Okay, so as you see here on the screen, on this slide, we see an iceberg. So think about who are your consumers. And really, our consumers are anyone that has a hearing loss. So when you look at this picture here, you don't see anything at first glance. So that is the same with hearing loss. The impacts aren't always visible. Next slide, please. So the impacts of hearing loss and the consequences could be the following, the things that are under the surface: financial, relationships. Often with a person who experiences hearing loss, they go through these issues such as self-esteem, independence, mental health, quality of life, health implications, which I will go into later on a future slide, as well as socialization impacts. You will notice people who have a hearing loss typically kind of withdraw from social activities. They seem to be more isolated because they're not hearing what's going on in social environments. Next slide, please. So here we talk about some health comorbidities and some medication issues. These things can have an impact on hearing loss. And also when it comes to dementia, diabetes, it raises the anxiety levels, and it also plays into falls and people being at risk. With dementia, for example, with moderate hearing loss, a person is at 3 times the risk. And then when you look at people who are at risk of falling, sometimes hearing loss impacts the balance and the vestibular system. So for someone that has even a mild hearing loss, they're at 3 times the risk for falls. For those people who have depression, sometimes that population is increased at a higher risk. That could be service members or veterans, because as a veteran, they're considered to be, a strong type of character and not used to relying on someone for help. Then when they have these hearing issues come about and they start to lose their hearing, that can lead to depression because now they need to reach out. Next slide, please. I want you to take a look at this slide and see all of the different signs of hearing loss. You might recognize some of these. I'm not going to go through all of them, but I'll pick out a few of them and kind of go over those in detail. It could be common for people to say, "What did you say?" That doesn't always mean a person has a hearing loss just because they ask that question. There could be background noise like a loud air conditioner running or something that would cause just your average normal person to miss what's being said. But if you notice someone doing this repeatedly, then that could be a sign that they have hearing loss. Another one that you see on this list is people might have a hard time joining in on group conversations because that's really difficult to follow. If you've got different people in a circle or around the room just speaking up here and there, it's hard to catch who's speaking. So it might be a good idea to set up some ground rules that only one person speaks at a time, especially in a group, because group conversations are hard to follow. And if you're on a cell phone or some type of telephone, if a person starts to lose their hearing, they might start missing words on the phone because they can't see the person that's talking and they start missing chunks of the conversation. They might ask you to repeat. If someone is constantly interrupting someone while they're talking, it could be unintentional because they're not hearing those pauses in the conversation. And it's not that they're being rude. It's just they sometimes might even not hear the person still talking and they just start talking. You might notice that a person starts to kind of bluff. They don't really understand what's going on, but they're just kind of nodding their head and going along with the conversation like, yes, yes, like as if they understand. Also, a person's responses. Sometimes if their response is off topic, they might have misunderstood the question. And if you're not getting a direct answer to the question that you ask, or for some reason it's off topic and it doesn't really have to do with anything you were talking about, that could be a sign. Next slide, please. Here we talk about some common assumptions related to hearing loss. Here's a few of these. As you see here, it says speech reading is a good accommodation for people with hearing loss. That's one of the false statements. Only 30 to 40% of what's actually said is visible on the lips. And that's not 100% effective. The next one, people with mild or moderate hearing loss can actually hear okay. No. When a person has mild to moderate loss, they actually miss many of the consonants, which causes certain words to sound like others. For example, if I were to say which, you might assume that I said peach or something like that, and I didn't. That's kind of just an example. The third one you see here, when a person gets hearing aids or cochlear implants, they can hear fine again. That's false as well. You cannot hear like normal if you get either of those devices. However, those devices do help a person hear better, but they're never going to have hearing like they once had before. With cochlear implants, a person will have a variety or a range of effectiveness of their device. Just as Katie said, not all devices or equipment fits everyone's hearing loss the same way as the next person. Next slide, please. So keep in mind that there are two major barriers. The first one is many deaf, hard of hearing, or deafblind patients lack the knowledge and resources to effectively advocate for themselves, especially for accessible communication in all areas of their lives. Secondly, service providers lack the knowledge and resources to ensure that deaf, hard of hearing, or deaf-blind people have the same access to their services and resources as the general population. Next slide, please. And then I'll turn it back over to Katie.
I'll give Caitlin a second to spotlight myself and the interpreter. All right. And so with our kind of logistic issues there to start with, we skipped our poll to start with. So I'm going to go ahead and ask Caitlin if you'll go ahead and pull up the pre-test, the poll questions. And go ahead and answer those. Hopefully a couple of them you may already know the answer to, since we've gone through a few slides so far here. But go ahead and go through those poll questions, answer them true, false. We don't know who is answering what, so don't be shy. Go ahead and take that poll. And we'll go over the answers at the end to kind of give you an idea of how much you learned throughout the presentation today. And I apologize, it looks like some of the slides maybe had some formatting issues when transferring from myself to Caitlin. So the top of this slide says Civil Rights Acts ensure accessible communication. That's the part there that's cut off. I'll give everyone about another 30 seconds to answer these questions. And then we'll go ahead and move on. All right, Caitlin, you can go ahead and close the poll. And I'll give everyone a second here to take a look at the results. Kind of compare your answers to some of the others and see if you fall within the majority. And it looks like the last question was pretty close there in responses. All right, very cool. Thank you, Caitlin. You can go ahead and close that now. We'll go on with the rest of the slides and we'll go over the answers at the end so you can maybe have an aha moment throughout the presentation if you got one right or wrong. So it's important to know that there are several civil rights acts that protect people with disabilities and ensure that they have equal access. These are just a few of the major ones to familiarize yourself with. These laws protect people with disabilities by making sure they have the same access to all aspects of life as those without disabilities. This includes individuals with hearing loss and requires entities to provide equal access to communication. Individuals with hearing loss must have access to the same information, programs, services, and goods as those without hearing loss. It's important to ask the person who's requesting access what they prefer or what they need for an accommodation. It's important to know that it is a responsibility of the service provider to provide the requested accommodation. Next slide, please. So here we have some communication tips. And communication is a two-way street. And for this reason, we have tips for both the person with hearing loss as well as the provider or the person communicating with them. So as the person with hearing loss, it's important to inform the provider that you have a hearing loss, and for the provider to ask you what is needed for effective communication. The hard of hearing person should be specific about their communication needs, and the provider should provide the specific accommodation request. The hard of hearing individual should reinforce helpful communication efforts, and the provider should accept feedback. The hard of hearing person should pick a quiet and well-lit place to communicate, and likewise, the provider should choose an appropriate space. The hard of hearing person should pay attention to the speaker, and the speaker should be patient and ensure that their mouth is visible when speaking. And the hard of hearing person should let the speaker know what they understood and what they did not. And the speaker should repeat and then rephrase and provide clarification. Next slide, please. Some additional tips for communication are asking for a private room away from loud noises, asking for written instructions, asking the speaker to wear a clear mask, asking the speaker to use speech-to-text applications, and asking for a personal amplifier, which we'll talk more about later. Next slide, please, and I'll turn it back over to Marilyn.
Okay. So when it comes to personal hearing aid technology, it is very important that you speak with your hearing healthcare provider or your hearing aid professional or the provider themselves. They are experts and can make some recommendations of what types of devices or technology would be best to help with the phone, the TV, and group settings. And that could include some types of technology such as microphones and amplifications. So these are just some ideas for general use that you see here on the slide. Next slide, please. So let's talk about T-coils, telecoils, and inductive loops. A T-coil is actually a small coil type of wire that's built into a hearing aid. This is a wonderful tool because this can be used in connection with your telephone, to a loop, or even a Bluetooth device. With the inductive loop, it provides lots of different types of access. It could be set up in a public space, such as an activity room, a chapel, a theater, but this has to work off of some type of hearing aid or cochlear implant. So those devices have access to link into the loop system. And this is for multiple people to access sound in a large space, such as an auditorium or theater. And just a side note, there is special funding that could be available for your facility if you wanted to set something up like this in a conference room or a large gathering space to help multiple people with hearing loss. Next slide, please. So let's talk about some amplified and captioned phones. These are some pretty cool devices that are out there. With both of these phones, they need to be connected to a landline. For the amplified phones, you can actually just have many benefits because they have multiple features, such as an extra loud ringtone. It has volume control, tone control, and some of them may even include a small flashing strobe light so a person can have a visual signal that the phone is ringing. When it comes to caption phones, these are good for people who hear pretty well on the phone, but might miss a word here and there. So they would have the words coming across the screen that they could look over if they miss a word. Also, on this type of phone, the font size can usually be adjusted, and it usually has volume and tone control as well. This can be connected via an internet connection or a landline, and it has some type of signaling, such as a light or something that flashes. That's hugely beneficial, but both of these phones are compatible with a hearing aid, or even for those who don't wear hearing aids can benefit from them as well. Next slide, please. On this slide, you'll see a couple of examples and information about personal amplifiers. The one that you see pictured here is a really nice device for a person to carry with them if they're going shopping, they're going to a store or some type of place, for example, away from home. It can be used in lots of different ways to communicate to overcome some type of barrier. It can be used with or without a hearing aid. There's two different types of either a headset that you could use, or you can just put it in like regular earbuds. It is rechargeable, and this usually runs about $100 to $200 in cost. Most patients can greatly benefit from this type of amplifier. It can be used with a hearing aid that has a T-coil or Bluetooth capabilities. One person could have that device and another person could have that device all in the same room, and they might be using that to communicate with each other, obviously not at the same time if people are taking turns, but it's very difficult for communication to work when there's multiple people having different conversations. But this is a great tool for people with hearing loss who maybe can't afford a hearing aid. It's a good temporary solution, but even people that have hearing aids might even still prefer to use this in connection with that. Next slide, please. Now I will turn it back over to Katie.
Now I'll give Caitlin a second to spotlight myself and the interpreter. All right. So when hard of hearing individuals want to attend a performance, watch a presentation, and Caitlin, we'll go back to the previous slide, please. Perfect, thank you. If they want to attend an activity, one way to satisfy the accommodation of several people at one time is to provide an auditorium type listening system. There are several different technologies these systems utilize, such as FM, infrared, radio frequency, and electromagnetic signals, and each of them has its own benefits. Each system has a transmitter and several receivers. So the presenter or the speaker would wear the transmitter, and the hard of hearing participants would wear the receivers. Each system should be able to be connected to the sound system currently in place. And some systems will require a new microphone to be purchased as well. Next slide, please. So apps are making a huge impact on assisting those with hearing loss to have mobile communication access. A couple examples of free speech-to-text apps here are Apple Notes and Google Live Transcribe. These are recommended for short one-on-one interactions, such as with a cashier at the store or asking a patient if they need a snack. These are not recommended for longer conversations of significant importance, such as care planning, medical appointments, and they do not perform well with multiple speakers. For those type of interactions, we would recommend using CART, which is what we're using today. There are apps that can be downloaded on smartphones that provide captioning during phone conversations on a cell phone as well. And we've given two examples here, but there are many more quality apps on the market. And smartphone applications can also provide more controls to users of certain hearing aid brands, such as finding their lost hearing aid, adjusting the volume, switching settings, and more. Next slide, please. So captioning is beneficial because it allows the person with hearing loss to listen while using the text as a reference point, reading when needed to understand difficult and complex words. And some people with hearing loss may rely solely on captioning to follow the conversation. Communication Access Real-Time Translation, or CART, captures the entire conversation word for word. A stenographer who is either on-site or remote listens in on a meeting and sends what he or she captions to a tablet, laptop, or smartphone where the person with hearing loss reads the text and follows along. It's also possible to have CART projected up on a screen or a wall during a meeting, a presentation, or an activity, so that many people with hearing loss can enjoy access to communication at the same time. CART can also be preferred for medical appointments. Next slide, please. So sometimes accommodations can be simple, like using pen and paper, and sometimes multiple accommodations might be needed for one person. The key is to open your mind and find something that will work for the hard of hearing individual. Remember that the ADA requires agencies to provide auxiliary aids and services, as well as considering the person's preferred method of communication, while keeping in mind the nature, length, complexity, and context when choosing the accommodation. An accommodation is not appropriate if the patient is not comfortable with it. For example, typing on a laptop is not an appropriate accommodation for a person with no typing, computer, or reading skills. Keep in mind that the same accommodation will not work for everyone, and even the same person might need a different accommodation depending on the setting. It's important to ask the person what will work for them and continue checking if the accommodation is working effectively. Next slide, please, and I'll turn it over to Marilyn.
I was pausing a second. I was having a little difficulty with my video, but now I'm here. Okay, so here at the Division of Services for the Deaf and Hard of Hearing, we have regional centers that cover the whole state of North Carolina. What we do in our division is we provide advocacy, consultation, education, information and referrals, anything hearing loss related. If you need some resources, if you need help looking for a provider, anything, we are here to help you. We also do trainings and presentations such as this, even on site. You might be hosting an event where we can set up a booth and give out some information, and that's included in the services that we offer. We also have an equipment distribution program, and we serve all residents of North Carolina who have a hearing loss. Our services are free of charge. Anyone can contact us for anything that they need, whether it be a question, needing some assistance, just needing some information. The important thing is to reach out to this regional center that is closest to you and covers your area, and we are all happy to help. Next slide, please. In addition to our agency, we also provide, as I mentioned, an equipment distribution service, also known as EDS. A person can apply to get some equipment for free. It could be a phone, such as an amplified or captioned phone, or it could be a hearing aid, Now, our hearing aids that we provide does include that T-coil feature that I mentioned earlier. A person can also get some speech impaired equipment if that person does have a speech limitation. There are also alerting devices available. And by that, it means someone that it's a device that can notify the person that the phone is ringing. So they can get, you cannot get a phone and an alerting device at the same time. There are some restrictions, but we can help consumers and we can meet with them one-on-one to help them do the application and let them know what they're eligible for. Next slide, please. In addition to applying for hearing aids or telephones, we do also offer alerting devices. Now, these are pieces of equipment that help people for general auditory alerts. For example, the doorbell ringing, the phone ringing. Some patients might prefer to have this set up outside of their room, like a doorbell, to where before you enter the patient's room, you can push the button just to notify them that you're entering the room, since they might not hear you coming in the room. Some of these devices can connect to a smoke or fire detection system, or even a carbon monoxide device. They can connect to that. If you already have something like that in the home, you just connect it to your existing equipment, just so you're alerted. It can also be paired with a special alarm clock. If a person has trouble hearing the alarm and can't get up in the mornings, any type of alerting device that the patient or consumer uses, this could help them function better. Next slide, please. And I'll turn it right back over to Katie.
All right, and I'll give Caitlin a second to spotlight myself and the interpreter. All right. So through the Division of Services for Deaf and Hard of Hearing, we also have temporary loan service hearing aid redistribution, in which we can provide previously used behind the ear hearing aids that are thoroughly cleaned and sanitized using UV and checked by an audiologist to ensure that they're fully functional. North Carolina residents can apply who have hearing loss or tinnitus, need a hearing aid to assist with hearing on the phone or hearing the phone ring, need a second hearing aid and may have received one from another source, or received one from the Division of Services for Deaf and Hard of Hearing's Equipment Distribution Service. Qualified applicants must be willing to pay and find their own hearing aid professional to be fit with the hearing aid. The individual can talk with the hard of hearing service specialist at one of our regional centers to discuss whether the hearing aid redistribution is right for them. And we'll share our contact information and website on the last slide. Next slide, please. The goal of the Medicaid Communication Access Service Pilot is to improve communication access for people who are deaf, deafblind, and hard of hearing in healthcare settings. Healthcare providers who have a Medicaid contract and provide services outside of a hospital setting can complete our short online form and start receiving the following benefits at no cost: a personal sound amplification device called a pocket talker, box of clear masks, training and education designed to meet your needs, and reimbursement for communication access like sign language interpreters and CART. Next slide, please. So now we'll see how you did on the pre-tests. Number one, 16% of the general population in North Carolina has hearing loss. That is true. Using over-exaggeration with your lips when pronouncing words helps a person with hearing loss to understand better. False. Number three, hearing aids and/or cochlear implants help people with hearing loss to hear normally again. That's false. It helps them, it aids in communication and helping them to hear, but it doesn't restore hearing to normal. Number 4, sitting or standing in front of a window helps a person with hearing loss to understand what you're saying easier. False. Having light from behind you or light from a window behind you can cause a shadow on your face and make it harder to see your facial expressions and your lips. Next slide, please. Number 5, if a person seems to not understand what's being said, first repeat, then rephrase a statement or question. That is true. The person with hearing loss should choose where to sit. That's also true. The person with hearing loss should have extra time to ask and answer questions. That's true. And most hard of hearing people can speech read with 75% accuracy. That is false. Only about 30% of what's said can be read on the lips. Next slide, please. All right. I'll leave this up here for just a second so everyone can take down our website, our email addresses, or you can use your phone or tablet to scan the QR codes to access our website or Facebook page. I did see some questions in chat regarding how to contact our different regional centers. And when you go to our website, we do have a section on our website which says regional centers, and there you can get the name and contact information for every position at our regional centers. All right, Caitlin, you can just leave that contact us slide up for just another second. And I will start by going through the questions that have been placed in the chat. And Sharon asked, are sign language classes or training available? So Sharon, the answer is yes, and it just depends on what your needs are. You can begin by going to our website and contacting your local regional center and discussing what your needs are. Depending on if it's a presentation similar to the one that we shared today, that can be done. But if it's specifically American Sign Language classes, you can talk to the deaf services specialist at the regional center, and they can talk to you more about if they can provide American Sign Language classes or if there's another service that may be more appropriate for you. And Anna asked, do you offer hearing clinics where you can test hearing and provide a device at a senior center? So through the Division of Services for Deaf and Hard of Hearing, our hard of hearing services specialist can provide hearing screenings. So we don't do full hearing tests or examinations, but we do provide screenings. Those are not diagnostic, but they are able to assist people who think they possibly have hearing loss. And you can contact the hard of hearing services specialist at your local regional center to talk more about that service. And for individuals, they can apply for our equipment distribution program for equipment such as hearing aids, alerting devices, weather alert radios, and items like that. We don't actually physically hand individuals hearing aids because that is all done by hearing aid professionals, audiologists, ear, nose, and throat physicians. So they don't actually get handed the equipment when it comes to a hearing aid from our regional center specialist. And we have a question about who do we contact at the Charlotte Regional Center to attend a community outreach event. I would recommend you either email or call the Charlotte Regional Center, and you can get that information from our website, and ask to be added to our e-blast list. And anytime we have flyers about upcoming events, we will send those out. We also have monthly calendar of events that we send out, which tells you all about the different events that are going on in that region, and then also sometimes some statewide events as well. And I see someone did put the contact information for Ivy Williams, and she is the Hard of Hearing Services Specialist in the Charlotte Regional Center. And then the last question that I see here in chat, is there a charge to use CART in an agency environment? And the answer to that is yes. There is a charge for both CART and American Sign Language services. We do have resources for both of those accommodations on our website. And you can talk to your regional center to get some more information about those services. However, to set up a contract or discuss pricing, you'll contact the contractor directly from your agency to set that up. And then I do see some more questions in the Q&A section. What are your thoughts about over-the-counter hearing products that will be available? So the over-the-counter hearing products, the final rule on that has not come out yet, but it is expected to come out sometime this summer or early fall. And that will hopefully provide additional accessibility and increased use for hearing aids and communication access for people with hearing loss. And Kelly asked, does the T-coil have to be installed before the hearing aid is constructed, or can it be placed after? I think that was the entire question, but it kind of disappeared on me. So the hearing aid, the telecoil is typically in the hearing aid before it's provided to the individual. About 70% of the hearing aids on the market already have a T-coil installed. So if an individual has a hearing aid already and they're unsure if it has a T-coil, they can just contact their hearing aid provider and ask them to check if it does have a telecoil. And if it has not been activated, they can activate that and set that up, program it for them. Because it does have to be, even if it is in the hearing aid, it does have to be turned on and activated to be able to be used. And then someone asked, can you tell us more about the Medicaid communication pilot? So if you have more questions about that, what you can do is email me directly. My email address is there on the screen, and I will share the contact email for David Littman, who's the administrator for that program. And also I'll share the link to our webpage where you can get more information and fill out the form to register for that. And I'm looking in chat. Who serves Rowan County? Rowan County would be served by our Charlotte Regional Center. And if anyone has any additional questions about what counties are covered, if you go to our website, to our regional center section of the website, it'll have a map. So it'll show you the breakdown of which centers cover which counties. Okay, and Anne provided some information. You can also tell if your hearing aid has a T-coil through the hearing aid app if you use one. And I think those are all the questions that we had in chat. And so Caitlin, I'll ask that you go ahead and close the PowerPoint. And if anyone has any additional questions, you can go ahead and put those in chat. Or if you prefer to come on screen, maybe and ask your question or sign your question, Caitlin may promote you to a panelist to come on screen and ask if necessary. But we have about 5 more minutes left, so go ahead and ask away. Thank you, Ivy. Thank you to everyone that enjoyed the presentation. Thank you to everyone for being here today. I know Caitlin said there was a good crowd out there. So I'm not seeing any more questions in chat. So if you think of anything else later on, feel free to email Marilyn or myself, and we'll get back to you with an answer to your question. If you need information on different regional center contacts, any of the programs or services that we provide, we'll be glad to get you that information. Thank you, everyone.
Yes, thank you, everyone.
A lot of great feedback. Just want to mention again that you will all get a recording of this presentation, and it will be on our website. If you have anybody you want to share it with, it'll be available for others to view later. So if you have any questions, just let us know. But thank you so much for being here today, everybody, to our panelists and all our participants. It was a great, great webinar.